first I'd like to ask you for your permission to use this video for educational purpose and on internet. Do you have any hesitation for me sharing your story?
Not at all. No,
Tell me about your symptoms and your life before the surgery.
My life before the surgery, I was sitting and doing nothing. I was doing nothing but watching TV and just being in pain. I was miserable. And I even had so much pain that affected my mind, and I lost my job because I couldn't remember passwords and I couldn't remember commands.
Yeah.
And I work in computers. Yeah. And I lost my job because it was just making me miserable and I couldn't remember things.
Yeah, unfortunately, this is lots of people go through that because of the pain, it's just a total stress. And some people even lose their not only job but their relationships and so on. So unfortunately, you have that in common with lots of people. How long was that going on?
It was about the last year before surgery that it was happening, that my mind was really affected.
But it has been the pain. How long?
The pain was very drastic the last 3 years before I got surgery. The injury happened 18 years ago, and I went up in Vicodin, and I was taking the biggest Vicodin. I had permission to take 4 a day for the pain, and I couldn't stand for very long.
So you were getting lots of Vicodin.
Lots of Vicodin.
To just get by.
Yes, to get by, and it didn't even make it so I could do things. Yeah. It was just so I wasn't in complete pain all the time.
Was pain in the back and the leg? Where was the pain?
No, the pain was center back.
Center back.
And it
not
was...
Not much in the legs?
No, not at all. It didn't go down my leg at all.
At all, okay.
Until after the surgery. Right after the surgery, I got a little bit...
Let's talk about before the surgery. How far could you walk before the surgery?
Before sitting?
Well, before the surgery, how far could you go for a walk?
Not even a football field. Not even 100 yards. I mean, I was just in so much pain. I would go that far, kind of, and then look for a place to sit down.
Okay. The surgery was just 7 months ago, right? Or 6 months, 7 months ago.
Yeah. In May.
And I'm going to turn around and show what we did. You had a previous, what we call spontaneous fusion of the bottom disc, and the second disc from below was the problem, and we put screws in. Here are the down view and so on, and here are practically the spacers. We put a spacer in L45 and put screws in L455 S1 in the back to just stabilize it. Do you remember the surgery?
Yes. Well, I mean, I was awake during it, but I remember being in the hospital, getting into it.
How long were you in the hospital?
I was in the hospital for 2 days. I didn't progress far enough to be released after the first night, so they kept me an extra day.
Yeah, and that is unusual for us because most of our patients stay just 1 night, but for open surgery, 2 nights is really nothing. Most of people stay even longer.
Okay.
Now, but initially we had some problem with the pain and the recovery and so on. Tell me about it. How was the first month or two?
The first couple of months I didn't have pain in my spot, but I had pain across my back, and I had a lot of weakness on my left side. I was falling sometimes. And I even hurt my knee once. And I wasn't progressing the way I wanted to.
Yeah.
I think it was because sitting for 3 years, you just get in miserable shape. You gain so much weight from just sitting and doing nothing because you're in pain all the time.
Yeah. But as well, surgery itself is not, this is a big surgery. So sometimes people need time. Now, this is the purpose of this interview, is to show some of the patients who are going to watch that even though statistically most of our patients walk right after the surgery, go home next day and recover within weeks, sometimes it can take longer.
Yeah.
And you are one of those people that we don't have the top-notch A kind of recovery, but it was a little longer. But in your case, it took how many months did it take for you to turn around and start getting better?
After about 3 months, I went to physical therapy. I spent 6 weeks doing physical therapy and talked to a different pain doctor and started doing a more gentle progression of therapies. And it was hard at first, and then it progressed really well. And I started feeling stronger. I started doing more.
How was the weakness in the left leg after that? Or how is it now?
The weakness in the left leg is, I would say, 99% gone. I kind of feel an issue every once in a great while when I do too much. But now it's just totally gone. I'm walking normal. I'm walking for exercise now and going
Tell me about it.
longer. I started doing like 3/4 mile, and then after 2 weeks I started ramping up about 100 feet a day, and it started getting better and better, and now I'm doing great. And I'm losing weight. My diabetes numbers is really down.
Good. How is the narcotic medication or Vicodin?
I don't take any at all.
How long after the surgery did you take Vicodin or narcotic?
About the 3 months.
3 months.
About the 3 months.
So you were for years on that. 3 months after the surgery, you came off it.
Yes.
Perfect.
And now I didn't even have that bad of withdrawals. I got withdrawal medications, and I didn't even use them because I just started feeling better.
Yeah.
When I started feeling better, I started taking less medicines overall.
Yeah, that is actually it's a good recovery because you have been on that for years and you weren't really ambulating much before that. So your recovery was extended, you're right. But overall, I'm very happy. Inside of you, bone is growing and practically your pain is getting better. But you asked me few questions when we started talking. You asked me few questions that your surgeon, I'm trying to hold you back. What question were you asking me about your activities and exercises and so on that I was telling you to?
I'm trying now to go heavier in my weightlifting to get in better shape. So because my friends are in that kind of shape.
So let me ask you, what number did you give me that you were asking me that you were trying to lift and so on? What?
I'm currently benching 175.
175.
And when we're at the heaviest, when I ramp up through the various lifts, that's the heaviest.
175 is almost size of a person. So you're
not me, but yeah, it's the size of some smaller people. Yeah.
So I'm actually very happy that now 7 months after that surgery, after being years in pain and not ambulating, you're asking me if you can bench a smaller person.
A smaller person than me, yeah. No, I'm very excited about it.
This is a good question to have.
Yeah, I'm very excited about it, and I'm making a lot of progress now, and I feel better, and life is getting better. And my mind's getting better, which is so great.
Yeah, and my answer to you was, all of that is okay, but just go up slowly. And to make small increments until your body tells you stop, and then stop.
Yeah.
And that is, I think you have a good common sense. Walking is getting better. Now, again, the purpose of this is that sometimes it takes longer to recover, but recovering 7 months after that big surgery is, comparing to open surgery, is really nothing. Some people need about a year or more to recover. So even though you are not our best recovery, you're still recovering twice as fast as open surgery.
Oh yeah, no, the open surgery wasn't for me because the doctor said I would come out paralyzed.
Now tell me about what you were told about the open surgery. What the alternatives? How did you choose us?
I chose you. I have a pain doctor. I had a pain doctor. I don't have him anymore.
Yeah.
I've stopped seeing him
That's
because
good.
I don't have pain issues.
Here you are.
But I had a pain doctor, and he found the open surgery was not an option for me because of the outcome would just be too traumatic. And so he recommended an OLLIF at Inspired Spine, and I checked it out, and and he said you could weather this and the outcome would be good, and it was.
Well-
He recommended you. I checked you out, and then
Well, we are still
got
not
it.
done. We are 7 months after the surgery. You're still going to get better, but I'm sure you will use your common sense to slowly go up on the any kind of exercises. And based on everything you told me, I'm very happy with the outcome so far.
I'm excited for life now. I wanna get started.
Yeah,
I
I
wanna
know.
get going.
You're
Yes,
itching
I
to
know,
get back
I
to
am,
life.
I am.
But just take it slow.
I will. I
Okay?
will.
Well,
Yeah.
thank you so much. That
Okay,
was a
thank
great
you. Yeah,
interview.
thank you.
And